Let's wait for my kids. Okay, everything is done. Yeah, perfect. Ready for today? Okay, everything is done. So let's wait. Just wait. And with the information, let's have our today class. I cannot realize why people. Well, let's see if everything's in accordance. Hi, Belkin. Ari.
Hi.
Hi, how are you? Can you listen
Great,
to me
thank you.
clearly? Hi, Ari. How are you, Ariana?
Great. How are you?
Fine. Everything's okay.
I'm happy to hear that.
Yes, I hear you clearly. Hi, Belkin.
Hi, how
are
are you? How was your weekend?
What? It was a relaxed weekend, I think.
Oh, amazing.
At least one time it's not enough, but
Yeah, I know. I'm feeling this.
how was yours?
Very well.
Okay, that's great. Well, your classmates are coming, so
Okay.
let's wait a minute. Hi, Ruth. Hi, John Harold.
Hi, how are you?
Hi, Ruth. How are you? I read your message. I said, oh
Oh,
my God.
yes.
Yes, patience. Everything has a supposed reason to be, right?
Yes.
So let's wait a minute more and then we can start because it's a long presentation, okay?
Okay.
I don't know what I did with this. Hi, John Harold.
Hello, teacher.
Hi, how are you?
I'm fine, thanks.
Okay, there's Johan. Okay. So you tell me when you want to start, and that's okay for me.
If you are ready, go ahead.
Okay, I'm ready. I'm just taking the systems, and it's important for me have my own register because sometimes could fail the networking checkup, right? Oy. Let me see. Okay, as I was telling in the workshop, today we have an interesting presentation because we are going to check all the procedures, well, a real approach to the most important ones, from invasive and non-invasive ones, right? So let me share the screen and we can do it. Can you watch my screen?
Yeah.
Yeah, perfect. So as always, make if there's any question, you can do it. There's no problem for me. I think it's clear, but that's okay. So we have our class of tonight. And we have all of these contests. And you see, as you can see, it's a lot of information to check today. So let's start in order to try to finish on time. We have the invasive and non-invasive procedures. What's the difference? The lab tests, endoscopy, X-rays, the CT, MRI, the ultrasound, and ECG, okay? So in that way, let's go. Invasive versus non-invasive procedures. Of course, we know, as we were telling in the last class, that we have some procedures to make according to get information from our patients. So it's important for us to be serious in that order and try to work on them as we really get the possibility to do, and how is the situation for the patient, of course. Belkin, can you read please the invasive procedures, please?
Yeah. Invasive versus non-invasive procedures. Invasive procedures is one which when the body is invaded or entered by a needle, tube, device, or scope. Is one where purposeful deliberate access to the body assigned via an incision percutaneous puncture, where instrumentation is used in addition to the puncture, needle, or instrumentation via natural orifice. Non-invasive.
Okay, go ahead, go ahead.
Non-invasive procedure does not require inserting an instrument through the skin or into body opening.
Thank you so much, Belkin. So you can see the difference, of course, is clear. It's a procedure for being invaded, okay? And of course, when we get a puncture, this puncture, of course, is hurting the patient. It's not an easy procedure to stand or to understand sometimes why we need it and why we ask for. What's the difference? The major difference between invasive and non-invasive tests is that invasive tests are done by cutting or entering a body part using medical instruments, whereas non-invasive tests do not require breaking the skin or entering to the body. I mean, the easy question is, does it hurt? If you said yes, it's an invasive procedure. Okay. If you say no, it's not an invasive procedure. As you can see the picture, this guy is so scared because of the situation. That's just a puncture, we say, but he might see like a knife entering into the body. So non-invasive tests include deep palpation, X-rays, and checking a blood pressure, as we were talking in the last presentation. The BP is a non-invasive procedure for evaluating our patients. And of course, we have to take the medical criteria to choose which one is the best and to try to make our patients understand why it's important for them to make them. Sometimes we ask, for example, lab tests made by a schedule 3 times, 4 times by day. And they said, why too much punctures? Please don't do this to me. But it's necessary because of the situation, right? For example, Ariana, can you read please this slide, the lab tests?
Yeah. laboratory tests. A medical computer that involves testing blood, urine, or other substances from the body. Laboratory tests can help determine a diagnosis, check to see if or monitor the
Okay, Ari. Okay, Ari, thank you so much, but I think we have some connection disturbances. Let me read it. Lab tests, a medical procedure that involves testing a sample of blood, urine, or other substance from the body. Lab tests can help determine diagnosis, plan treatment, check to see if treatment is working, or monitor the disease over time. We know the objective of this kind of studies is done. So we must use the medical criteria to check them. As I was telling you, it's important for our patients. One of the most common situations, of course, is the taking blood. We have words that are blackened. Of course, it's our vocabulary for studying and practicing and getting the correct expressions for doing it. And don't worry. So let's understand this. The taking blood situation. During the venipuncture, the phlebotomist, this guy, a technician who takes blood, inserts a needle into a vein and withdraws blood into a specimen tube, which is sent to a hematology laboratory for analysis. Usually the phlebotomist can find the vein in the inner part of the elbow, the antecubital fossa, that is easily accessible, the most one. Of course, all we know, I think we're taking blood in maybe an opportunity while we were students during the medical school, or maybe if we are studying at this moment, we have the opportunity for doing this. Let's go. Usually it's a girl, so she might apply a tourniquet, a tight band above the side, or the patient may be asked to clean their hand to make a fist. It's not a usual situation in our country, but in some other countries, it's possible to make. So in order to make the vein more prominent. Afterwards, the patient may be asked to press lightly or undressing, usually a piece of gauze, to help the blood to clot and to prevent swelling and hematoma, as black and blue mark or a bruise where the vein was punctured. Note, a bruise is a specific mark. Bruising can be used to describe a number of bruises of a larger area. The patient exhibited bruising on the right forearm. For example, when we have some patients that have troubles with drug addiction and they usually use puncture on the forearm, we see the bruises and it's very hard to skin and it's not easy to puncture again in that place. We can try and try and try, but there is no possibility because it's a bruise that of course complicates the procedure. Or maybe with the elderly people that is going to the hospital too many times, it usually happens. Well, with taking blood, we must study please this vocabulary, okay? It's gonna be for homework. A microbiology request form from, of course, we know, we practiced medicine using this kind of paper, of documentation, and we know that some of them, well, each hospital has its own model, own chart, about the studies they make in their own lab, okay? So we have to understand this. In this chart, we use abbreviations in order to get more information. We use abbreviations to make it easier for the trained personnel that is going to develop the study. So in that way, we have some meanings to study. For example, MSU, the midstream urine, CSU, catheter specimen of urine, NP secretions, nasal passage secretions, the BAL, blood alcohol level, very common situation to ask for, nose SW, nose swab, SW in virus TM, swab in virus transport medium, not free, it must be into a special tube, specimen tube with a transport medium that freezes the virus and it's easy to practice with it. The EDTA blood, ethyl enediamine, tetraacid acid, in vitro anticoagulant, it's easier. Just the abbreviation for knowing that it's an anticoagulant we are using for. The CSF, we know it is. The MRSA, methicillin-resistant Staphylococcus aureus. We know for bacteria, we have more of these abbreviations to understanding, okay? Or even antibiotics for understanding what is happening. Vancomycin-resistant enterococci. So vancomycin is not one of the best medication at this moment. Or carbapenem-resistant enterobacterials. We must understand this situation. Extended the spectrum of beta-lactamase. So, I mean, we have with these abbreviations an easy way to ask for a specific study and not get into confusion with our patients. Pertussis PCR, we have the protein chain reaction just specific for pertussis, for example. We know it because we were in the medical school, so we have the idea about what we are talking about. Just in English, we might understand that it's a different way of asking for. And of course, we must practice, okay? That's why we have this guy for remembering this situation. And I written down the most common ones, but of course we have some more situations to practice and to check. The biochemistry and hematology lab report. We all know what it means, how the values come from the laboratory to us, and how we are going to get the correct interpretation, and of course their abbreviation about what we are working on. The full blood count is going to take into account hemoglobin, hematocrit, white blood cells, and mean cell volume. The white cell count, WCC, is the most common situations. You see just the abbreviation in some reports, and then you must interpret it in order you know how you were talked about it, right? And we always know the units of teaching. In Latin America, we have a way of using abbreviations. In Europe and United States, they have another way. So it's just for having practice and practicing the conversion chats. Yeah, the units changes. We have an example from normal values, this complete chart taking into account the most common situations in Latin America and how we can interpret it. And we have the unit abbreviation and the full form from the Europe and the American school, medical school, I mean. Well, it's easy for us. For example, this FL femtoliters, usually we don't use in Latin America, right? But we must understand that in other countries, we are going to see it. And of course, they are going to practice with it during this class because the objective is to speak in English, yeah. And that's just for having an idea that it's important for us to take the mean count. Units per liter is very common. Of course, we use it all over the world. Grams per liter all over the world, but well, 10 elevated to 9 per liter, that's okay. Times 10. to the power 9 per liter. That's perfect. And that's a very important situation. The terms used to describe a lab result. Of course, we have with a plus the elevated without or reduce with the low symbol, okay? Wow. When the results are within the normal range, doctors say that the values are elevated, the values are up, the values are high, the values are raised, and give the value, okay? When the values are low, they said the values are down, the values are low, the values are reduced. For example, potassium is within normal limits. Okay, potassium is normal, potassium is unremarkable. It's not important at this moment. Potassium is low, low in contrast to limits, and you give the value, you show what's the trouble in that way. Potassium is elevated, and it's better if you see the value. That's the way to express in a correct way, the correct expression for showing this. So until this part, any question maybe? I think it's easy to make because we have all the practice for doing it, right? Okay, let's go ahead. We have the endoscopy. As I was telling you, if I get the pronunciation, I'm going to add it in order to do it in a better way, okay? The endoscopy is a procedure that uses an endoscope to examine the inside of the body. John Harold, can you read the rest of the slide, please?
Yes, teacher. A procedure that uses an endoscope to examine the inside of the body. An endoscope is a thin tube-like instrument with a light and a lens for viewing. It may also have a tool to remove tissue to be checked under a microscope for signs of disease.
Thank you so much. Well, and we have here a joke, right? Just for having fun and remembering that not always has to be so rigid. The doctor said, our usual technician is on vacation, but don't be nervous. This guy is equipped with a camera and can easily squeeze himself and down into your stomach and get some great shots of whatever is going in there. So that's a joke, but sometimes that kind of funny situations can remind us what we are making this kind of studies. We have the characteristics of an endoscopy, an endoscope. And we have to consider that it's not a very common device, right? Catherine, hi. Can you read, please, this slide?
Yes, teacher. A typical endoscopy is a flexible tube which is inserted through one of the natural orifices. Openings such as the anus or mouth.
The anus.
Anus. Okay. Reading endoscopy, which cannot bend, are also used, but are inserted through a small incision. So yes, surgical cuts. The sash contain several channels to transmit light from the outside and images from inside and allow different instruments to be used.
Okay, thank you so much, Catherine. So I think we all meet this device, or maybe if we didn't do it, we are going to see, or we're going to have the experience to assist an endoscopist to do this procedure. We know it's flexible, but in order it's flexible, it's fragile. So we cannot bend it. It's so much. It has a limit, and we have to take care of, because it has optic fiber inside. And if we break one lens, we are dead. It's not easy piece to recover or to get to replace. The rigid ones, they are not used all the time, just for specific situations, specifically for endoscopic intervention and for treatment. But it's a situation where the patient is under anesthesia effects. So it's easy to understand that it's not made by anybody. It's made by very, very trained, well-trained personnel. It's not easy, but in my experience, I wouldn't do it. I never did it by my own. I always be an assistant to my chiefs, and they were amazing ones. And with the shaft, this specific piece, we have some channels to send instruments for taking biopsies, for making electricity and closes an hemorrhage, for example. And with these pictures, we can get a better idea how this device gets bent and how it gets into our body, right? This invasive procedure, of course, it's harmful, it hurts, but we have to use anesthesia, local anesthesia for throttling by spray, and then we can start this. And we see all the images through a video like this picture. And we have the idea about how it works. We have the lens showing us the imaging, and we have the piece for taking the biopsy, right? The biopsy sample and the stomach line. Of course, it's just an endoscopy and upper one. So the functions of the endoscopy, Maria Fernanda, can you read this slide, please? Fabiola, can you read this slide, please?
Teacher,
Okay, can you listen to me?
Okay, no, Fabiola, can you read this slide, please? Functions of endoscopy.
Okay. Functions of endoscopy: to provide diagnosis information, to excise, cut out diseased tissue or growths such as polyps, to clear obstructions, to take biopsy, to cauterize a site of bleeding by applying heat.
Thank you so much. So you can see very, very not common situations, but very harmful situations, and very necessary to be trained for making this procedure. For cauterizing, of course, it must be a gastroenterologist who make this. And I had the opportunity waste syndrome. It's not a situation because cover the cauterization. Well, but we have to depends on the I am sorry, I have some connection disturbances. Let me share again. Can you watch my screen? Hello,
Yes.
can you listen to me? Can you watch my screen? Okay.
Yes.
Okay, so let's go ahead. So we have another variety, the enteroscopy, of course, taking more space, going to the small intestine and checking the inside of this structure and how it gets into, right? And with the enteroscopy process, of course, we have to start with fluids and sedatives by intravenous fluids. The physician inserts the endoscope into the mouth and slowly move into the small intestine. We swallow and swallow and swallow this device. And then the endoscopist can start recording all the procedure and the structures. The endoscope removed after results are collected 1 to 2 hours. Of course, it's a long study. And let's wait just for the recovery room with the results and all the situation. We have some expressions to check the enteroscopy instructions. Johan, can you listen to me?
Yes,
Please, can you read these instructions, please?
of course. Enteroscopy instructions, some expressions. Now I'm just lubricating the tube with jelly, which contains a local anesthetic. It will help to ensure a smooth passage as it passes down, and you shouldn't feel too much. I'm going to feed the tube through your nose. This is the most uncomfortable part of the procedure, but it's very brief. You will get used to the tube in a few minutes. Time, okay? When it hits the back of your throat, take a deliberate swallow. I'll tell you when. Now, swallow. That's it. Well done.
Okay, thank you so much, Johan. So you can see more vocabulary expression. Yeah. Okay, just lubricating, the jelly, the local anesthetic. It passes down, as I was telling you. It goes through the mouth, and the patient has to swallow and swallow and swallow by finishing. This expression, this part when says the tube is going to be fed through the nose, is because we are going to introduce some liquid through the nose in order to help the tube to be swallowed. But it's uncomfortable, but we can do it. To report a diagnostic endoscopy, well, it has to consider many situations. First of all, the legal parts and how we describe this, how we use this kind of expressions, I mean, how we describe this process for before taking the test. We have to get the informed consent, and when it was obtained from the patient after discussing risks and benefits of the procedure. The patient was connected to the pulse oximeter and placed in the left lateral position, as you can see in the picture. Oxygen was provided through a nasal cannula, and the premedication administered as stated, through the mouth anesthetic, the spray, okay? The endoscope was introduced into the esophagus, and at the end of the examination, the patient was transferred to recovery area to recuperate. So we know if anybody has been made on this or has the necessity of being done this procedure, knows how uncomfortable it is. It really is. It's terrible, but we have to understand that it's important. Anybody can say what is important to use the pulse oximeter? Anybody has an idea why we must check the oximeter all the time and the heart rate? maybe an idea why even it's a safe procedure if the personnel that is doing it is trained, why not everybody can do this? Why not me in the emergency room cannot do this? Nobody? Maybe an idea? All the
Maybe for
devices,
the oxygen pressure.
yes, could be the oxygen pressure. But what happened? We know in the anatomical reviews we were checking that the esophagus is next to the heart in the mediastinum, right? Do you remember that picture? Maybe we have now the idea. We have the heart and we have the esophagus. And well, there's not clear. Okay, here. We have the esophagus and here is the heart. Is the diaphragm, we have the heart. When we pass through the endoscopy lens, we can touch the walls of the esophagus. It, of course, we are expecting it happens. But what happens if we touch that portion that is next to the heart? We can cause an arrhythmic attack, for example, an atrial fibrillation. We can cause it. That's important for us to check the pulse oximeter because it also checks the heart rate and the oxygen levels. If something in heart is failing, we must consider that we are making a bad procedure, okay? Of course, we can control it in the emergency room, in the endoscopy room, but it's a procedure that needs to be practiced and trained for the specialists. That's why not everybody can develop these procedures. If we have elderly people and we cause an atrial fibrillation because we're introducing with so faster the endoscopy lens, we can cause a heart attack. And in order the patient is laid down and is almost with an anesthetic drug that is controlling in some case the pain, and so many situations elderly people don't feel that kind of pain. It's possible that we finish the procedure with a corpse, and it could happen. Sometimes in the literature, in the medical history, you can read similar situations about that. But it's interesting because we must be considered to get the patient connected to a monitor if we consider it's necessary for check all the time this situation, right? So that's why we look for the informed consent. With this paper, we cannot do anything in invasive procedures because informed consent is the legal document, the legal paper that show that the patient knows the risks, the family knows the risks and the benefits, of course, and they agree about taking these risks, the risks. If we don't inform it and just perform it, we are making the mistakes. We are the problem, not the patient. So when we talk about recuperate, of course, because the patient needs a time to relax again and to lose that local anesthesia in mouth. And this is an example of the report. It has some elements that are very important. The consent that is explained, how it was taken. We have to consider the risk and benefits procedure were explained. Consent has been signed. Mal-empathy score was 1 and as a scale was 1. These scales are showing us that we have a correct open mouth and a correct view of all the oral structures, okay? What's the medication we are using for? What kind of anesthesia and doses and the administration via? The monitoring, the vital signs, the oxygen. So it was done continuously. That's why I was telling you it's important for us. Maybe using a monitor, not just a pulse oximeter, but it's important. And of course, never forget the oxygen because the patient, in order he can breathe by himself, it's not easy to breathe with a tube inside the mouth. So we can help. Oxygen, it's never a bad idea. We must check the vocal cords, of course, the esophagus, the stomach, the duodenum, and that's the only part it takes the enteroscopy, not more. And of course, we have the assessments. In this case, it's a normal situation. So that's without these elements, if anyone is missed, the information, the paper is wrong. There is no way for working on if it's wrong. That's important to understand, okay? So now we have X-rays. Well, with the X-rays, Agar, can you read this slide, please? Agar, can you listen to me? Oi, you're with... Hi, Agar. Is everything okay? Well, if there is no possibility, don't worry. I'm going to call Ruth. Can you read this slide, please? Don't worry, Agar, I understand.
Yes, X-ray, a type of radiation used in the diagnosis and treatment of cancer and other disease. In low dose, X-ray are used to diagnose disease by making a picture of the inside of the body. In high dose of X-ray are used to treat cancer.
Thank you so much. Well, I don't know what happened with my picture, but I'm going to correct it. Well, we have to understand the difference between radiography and radiology. Okay. The radiology and of course are similar, but not the same. Well, let me read it. Radiography involves exposing a part of the body to a small dose of radiation. Okay, as Ruth was reading. And to produce an image of the internal organs. Organs with high density, such as the ribs and the spine, are radiopaque, meaning they do not absorb radiation and appear white or light gray on the image. Lung tissue is radiolucent, absorbs radiation, and appears dark on the image. So you can see radiopaque and radiolucent. We know all of these difference. Radiology is the use of radiation in the diagnosis and treatment of diseases such as cancer. Yeah, we see radiopaque and radiolucent just for getting the idea of the vocabulary, but we know this difference. And we have the review areas, anatomical structures we can recognize in a chest X-rays as the most common ones, just for remembering, just for having an idea or what we are looking for, what we are going to find. And of course, checking the vocabulary we have on these pictures. In the abdomen, of course, we can check more situations, abdominal X-ray anatomy and the review areas. And we can see, and we have some situations that we can check on, we can remember from these pictures, right? So let's do it, let's practice. And well, as for you. Hi. Before some types of X-rays, patients are given a liquid called a contrast medium, such as barium or iodine, which is radiopaque and allows the organ or tissue it feels to be examined, introduced through the anus, such as an enema, or or given as this. Imagine it's a contrast. Imagine, we know it. We were practicing with this through the years. Of course, with the X-ray examination, we have for taking the situations, okay? John Harold, can you read this slide, please?
Yes,
Harold.
teacher.
Okay, thank you. Go ahead, please.
Normally, a frontal anterior-posterior view is obtained. The patient stands facing the photographic plate with the chest pressed to the plate, with hands on the hips and elbows pushed out in front. The radiographer, the technician who takes the X-ray, asks the patient not to move, then to breathe in deeply and not to breathe out. This makes a blurred, unclear X-ray image less likely and improves the quality of the image, as it is easier to see abnormalities in air-filled inflated lungs than in deflated lungs.
Thank you so much. So you can see the position that is being described in the picture, right? So the chest pressed to the plate, this big quarter, with hands on hips. You can see, well, the picture is not clear, but hands are on the hips. And elbows push out in front. This position is better. Sometimes it's too wide and it's not possible to make it the way I'm doing at this moment. And then take breathe in deeply. And you have to start helping these patients for taking this image. Okay, now we have to consider that not we have the anterior posterior view, we have lots of views, but the most common ones are this one, the AP1, and the lateral view. Depending on the situation, you can ask for this one. Catherine, would you like to read this slide, please? Catherine?
Yes, teacher.
Okay, go ahead, please.
For a side or lateral view, the patient is asked to stand sideways to the photography, play with arm raised. A check X-ray maybe repeat interval to track for any change. These repeat examination are called several check X-ray.
Okay, thank you so much. So you can see this in a lateral position, arms raised, like in the picture, and then you take one. If there's no clear lesion, you can turn the patient around and repeat it in order to get the correct image. And we have the anatomical references just for having a remembering idea of what we are looking for, what we are watching. We have the PA versus the AP, of course, we know the differences while preparing just for remembering information. And we have these ones, pathologic, normal one, viral pneumonia, and the COVID-19 pneumonia. Of course, X-rays help us to get this diagnosis, but a better study for this is the CT scan. We know it. This is for information. Of course, it's just for having an idea. This is a baby. There are baby radiographs, baby pictures, just for remembering that, of course, they can suffer this situation too. We can go ahead. And another joke, I'm sorry, I love to put them. Don't be alarmed. It's just our technician photobombing your X-ray, saying hello. I don't know why I like it so much. So let's go ahead. The computed tomography You have here the pronunciation, computerized, computed tomography. Yes? Belkin, can you read this slide, please?
Yes. A procedure that uses a computer linked to an X-ray machine to make a series of detailed pictures of areas inside the body. The pictures are taken from different angles and are used to create three-dimensional view, 3D views of tissues and organs.
Thank you so much. We all know, we all have the experience to check a device like this. It's like a donut, we know. And with this one, we have this bed, and the bed goes in and out for taking the pictures for the section we are asking for. Of course, the CT scan uses an X-ray source which rotates around the body to procedure cross-sectional images. Sometimes you use a contrast agent to help images to appear, to line on a table outside of the scanner. The table slides into the scanner, as I was telling you, and the scanner spins around taking X-rays. It uses lots of radiation. It's around taking 600 of pictures of X-rays. One we have to know. Well, I'm sorry, I'm in another device at this moment. I'm trying to solve my connection disturbances with the principal device, with the presentation. Give me a moment, please. I'm trying to reconnect it again. I don't know what is going on because everything was okay. So give me a minute to change the device, okay? The computer is going worse.
Okay.
Okay. Can you give me a minute, please? And I'm correcting it. I'm uploading the presentation into another device. So I think from this we can work better. Okay. Okay, I'm changing device. Okay, now. Can you listen to me, everybody? Okay, perfect.
Yes, we listen to you.
Let me share my screen. Let me share. Okay, perfect. Let me look for where it is. Mm, 37. Okay, can you watch this? Oh, it's not.
Yes, we can see it.
Okay, now it's better, right? Yes. The magic of technology. I love it. So in order we were talking about these situations, we have here the 3D reconstruction that Belkin was reading for. And of course, the scanner takes up to 16 simultaneous cross-sectional images, the slices, and transmits more data in less time than ever before. So we must consider this situation. Each slice can be less than 1 millimeter thick, making possible to find very small abnormalities. That's why the CT scan is better than X-rays in many situations, right? And we must consider that the scanner will be used for diagnosis and diagnosing muscle and bone disorders, locating tumors, infections, and close monitoring the progress of malignant diseases and the response of therapy to treatment, providing accurate guidance for interventional procedures such as biopsies and the drainage of course, removing fluid from the site of an injury of infection. We have some examples from CT scan, and we have this one that is very important, the COVID-1 again, the COVID-19. Talking about the magnetic resonance imaging, we must consider that, of course, it's a procedure that takes more specific indications, not a common study, of course, right? It's a procedure that uses radio waves, okay? A powerful magnet and a computer to make a series of detailed picture of areas inside of the body. It not takes radiation, but the waves it takes are, of course, different from the ones we are expecting to take with the tomography scan. MRI is safer than X-rays because it does not radiation, as I was telling you. It provides more information than the CT scan. The unit 37 is the last class, I'm sorry, about some head, neck, and spinal disorders because the images are more detailed and have more contrast, meaning the difference between dark light areas are stronger. Unlike the CT, the images can be taken on any plane, any surface of the body seen from the angle. It's now used for imaging, taking image of the brain, the heart, and the oncology. Okay, when we check the brain, we can see perfectly the surface, the structures, all the recoveries, all the movements, and we find small lesions like these pictures. We have here in the C picture a small tumor that are, of course, looking for with this kind of a study, and the C and the D image, we can read the sagittal view of T1W flare plus C. The lesion was with minimal rim enhancement. It was not a very difficult situation to treat, I mean. Contraindications, of course, we have not all the situations to use it in order it's a magnetic situation to work on. Cases in which it should not be used include patients with metalline foreign bodies. We have a foreign body in the site. Sometimes we have plates covering the brain, replacing a piece of the brain of the skull, like a treatment, a surgical treatment for doing this practice, for saving life, or maybe in knee, in wrist. We have some jaws, some structures that are helping us to recover from a fracture, okay? And patients with pacemakers, electronic devices surgically implanted to regulate the heartbeat, right? We have this, an example of this in an X-ray. MRI is also not approved during the first trimester of the pregnancy, but during the second and the third, there is no problem. The fetal MRI is now a common study in the countries of the first world, as we say, for checking the body structures of the fetus and get congenital disorders or maybe abnormalities or maybe some situations that with the ultrasound we cannot check, we cannot treat. And with the MRI also we can use it as an intervention device, as we were telling with the CT scan, but with the MRI, for developing these procedures and saving the baby's lives, the fetus lives, okay? So preparing for the medical imaging, it means like in the endoscopy, We have here all a process that help us to get the correct way of having the study. First of all, complete a safety questionnaire. This safety questionnaire asks for, of course, foreign objects, ask for the for the pacemakers, ask for the situation in pregnancy if there's a woman who's going to receive the study, ask for if we are using dental implants and what kind of material we are receiving for these dental implants. And we must consider that we can eat and drink normally, okay? There is not a requirement to be in fast as in the CT scan, okay? With the CT scan, we need hours for being in fast, even though we need it with the ultrasound. But with the MRI, we don't have that trouble, okay? We must remove metallic objects, credit cards, because of the metallic slide that it has in line of taking the prices. You will be asked to line on MRI scanner table, this one, and make yourself comfortable. Get rest and get comfortable because the test is going to take around 45 minutes. The radiographer, the technician, is going to position the part to be scanned carefully. And during the MRI scan, you will not feel anything, but you will be required to stay still. Please don't move, stay quiet and don't move any bone because it's important for us to have the idea that you are listening, that you are, that we can take the correct imaging, of course. Now we have the ultrasound. Johan, can you read this slide, please? Johan.
Ultrasound.
Thank you so much.
Procedure that uses high energy sound waves to look to tissues and organs inside the body. The sound waves make echoes that from pictures and the tissues and organs on a computer screen. Ultrasound may be used to help diagnose diseases such as cancer.
Thank you so much. As you can see in all of this presentation, we are talking about diagnoses such as cancer, but it's not the right concept, the right idea I'm trying to show. The ultrasound, MRI, and CT scan, X-rays are going to show us the structures that are wrong, not just cancer. Maybe, for example, checking here the fetus. Well, it's a fetus, it's not a cancer. We must consider that this situation, okay? In our book, we talk about cancer a lot, but it's not the idea, and we all know that it is the situation. Well, the ultrasound examination uses high-frequency sound waves to view organs and structures inside the body. The waves are generated and received by a handheld device called a transducer. The reflected waves are processed by a computer, which produces detailed images or display on the monitor. Ultrasound is safe as it doesn't, as it does not employ ionizing radiation like X-rays. It is a cheap, quick, and non-invasive investigation with no surgical procedure. For a wide range of referrals, although results can be unsatisfactory in obese overview. Because with obese patients, we cannot check all the structures in the way we want. With the transducer, we have the transducer, the health, the skin, the sound waves, and the tissue. And of course, we can check the organ. And depending on the intensity of the transducer, we can check all the organs we are looking for. So, just for remembering about preparing an ultrasound, Maybe Ruth, would you like to read this slide, please?
Yes, preparing for ultrasound. You will be asked to lie on examination table. A special gel is applied to your skin. This ensures there are an air pocket between the transducer and your body. The transducer is moved over the area to examine. You may feel some pressure and experience some discomfort, especially if the test requires you to have a full bladder. You may be asked to change your position for clearer pictures. When the radiologist is satisfied with the picture quality, the test is done and the gel is ripped off. A typical test may take between 20 minutes and 1 hour.
Okay, thank you so much, Ruth. So we must understand the situation. This study depends on the eye of the radiographer, of the radiologist, of the one who's developing this study. Okay, it's not an easy study to develop, but we must understand that if I don't check the structure, if I don't check how or where this structure has the lesion, I'm not going to be capable to describe the lesion, and maybe I can make mistakes. It's eye dependent. That's the expression. It's an eye dependent study. It depends on the radiologist, the technician, the one who's developing this. It's of course for an specialist, not for everybody. And we have these important expressions about describing medical imaging. An ultrasound scan showed an intra-abdominal abscess. This is the most important verb, the showed. An ultrasound scan of the abdomen demonstrated a small right renal tumor. An ultrasound scan of the liver revealed reduction of metastasis. So we have three important verbs to use for in way to read and to show how it's working, how it's been developing this study, okay? And now we have the electrocardiogram. I think one of the most important studies. And well, everybody knows, we all know how it's done. Fabiola, would you like to read this slide, please?
Okay.
Fabi, thank you so much. Go ahead.
Electrocardiogram is a simple test that can be used to check your heart's rhythm and electrical activity. Sensors attached to the skin are used to detect the electrical signals produced by your heart each time it beats. Is a tracing or drawing produced by an electrocardiogram, a device which records electrical activity in the heart. An electrocardiogram records the electrical signals in the heart. It's a common and painless test used to quickly detect heart problems and monitor the heart's health. An electrocardiogram, also called ECG or EKG, is often done in a healthcare provider's office, a clinic, or a hospital room.
Thank you so much, Fabi. So now you can see, we all have been practicing with this. We all have made one of these. We all organized this study with our patients. And we know the uses of an ECG. It can be used for deciding if the heart is performing normally or suffering from abnormalities. For example, cardiac arrhythmia, extra or skipped heartbeats, indicating damage to heart muscle, such as heart attacks or ischemia of heart muscle, the angina, detecting conduction abnormalities, heart blocks, and bundle branch blocks, the BBB, triple B, screening for ischemic heart disease during an exercise tolerance test, often carried out on an exercise bike or treadmill, providing information of the physical condition of the heart. For example, if patients with left ventricular hypertrophy, LVH, detecting electrolyte disturbances, for example, low plasma potassium levels or high plasma potassium levels. We know the difference between low and high plasma potassium levels. And here we have some images to consider and to remember, to have an idea of what we are looking for. We have the normal morphology, the hyperacute T waves, wide and tall, ST elevation, the Q waves and the T wave inversion. The ST elevation improves, the T wave normalizes, and the Q wave is persistent. An abnormal EKG showing ischemia, angina, and infarction. We have the process on all of these pictures, right? And we have more patterns of abnormal EKGs for studying, okay? The ECG is one of the most important studies we developed during our whole career. That's why we must understand. The procedure, all we know is just for getting the correct vocabulary and way of expression for doing it. Maria Fernanda, are you there?
Yes.
Thank you. Can you read this slide, please?
The patient should lie down and relax, calibrate the ECG machine. A standard signal of 1 MV should move the stylus to large squares 1 centimeter vertically. Attach the lymph leads, left arm, LA, right arm, RA, left leg, LL, and right leg, RL. Record the 6 standard leads, 1, 2, and 3, augmented voltage right arm, AVR, augmented voltage left arm, AVL, and augmented voltage foot, AVF. 3 or 4 complexes for each. Apply the electrode to the 6th chest position in turn, recording 3 to 4 complexes of each. If the rhythm does not appear to be sinus, normal rhythm, a rhythm strip of 6 to 10 complexes in a single lead should be recorded.
Thank you so much, Fernanda. So you can see there's a way, a position specifically done for taking this study. And it's well described in this chart, okay? Now we have the position of every precordial derivation, V1, V2, V3, 4, 5, and 6, of course, with its own color. It's a universal division. And we have the anatomical space it's placed on, and when and how we have to put them, okay? These colors are not going to change in any country. As I was telling you, worldwide, all of the world, we have the same distribution. I tell you by experience, every country I met, where for working, the distribution was the same. And now we have the normal ECG. The normal ECG is showing us, of course, the structure in the complete structure we have. The picture shows an ECG tracing of a normal heartbeat, showing a P wave, a QRS complex, and a T wave. Each large square is equivalent to 0.2 seconds. The RR intervals gives the heart rate. In this case, is 75 per minute. In the case of abnormalities, the QRS complex can be widened or too tall. The ST segment can be elevated or depressed. The T wave can be right way up or inverted, the wrong way up. So just for getting the idea, we have this picture when we have the P wave, T wave, U wave, PR segment, ST segment, QRS complex, PR interval, QT interval. All of these structures have a medical meaning, have a medical structure to understand the information that they are bringing us from the heart. It's not an objective of this presentation to talk about it, but maybe another time we can do it. And we must consider that we are trying to get this vocabulary with the blackened words, okay? So we have here an example of the normal ECG, the full view. We must consider the differences between the leads. The 1, 2, 3, 4, 5, 6, the IVR, IVL, IVF, and 1, 2, 3. All of them have a position. And if we have a bad position place, we are going to get a bad lecture or bad record of the study. And we have 10 rules of a normal ECG. Of course, with the size, considering the squares for taking the correct size of every wave, considering how wide is the complex QRS, and well, considering the position, considering the order, how the T waves and the QRS complex tend to have the same direction in the limb lead, so you can see these details. We have all waves are negative in the late AVR. We have to check this. This is important because we can see, well, I have the experience that in an opportunity, I placed it in the wrong way. And the key for having the idea that it was wrong was this structure, the AVR was wrong. So we can do it again. The R must grow from V1 at least to V4, and the S must grow from V1 at least V3 and disappear in V6. So you can see how it's going up and up and up and then down, down, down until disappearing, okay? There are 7, you have the ST segments for volume. There are 8, the P waves should be upright in the 1 and 2 and from V2 to V6, you can see in the pictures. There are 9, there should be no Q wave or only a small Q less than 0.04 seconds in within 1, 2 and V2 to V6. So we must consider all of these rules and then consider that we are practicing with people. We are trying to get a diagnosis in order to help someone else. The objective of the book we are studying is just normal ECG. The abnormal one is the interesting one. And of course, we have to consider that greatness is a lot of small things done well, right? If we do our job, if we practice and we read and read and read again and have enough situations to perform our aptitudes, our talents to develop and practice medicine, we are going to reach greatness in a time. So let's practice. We have lots of studies in this picture, so I hope it's gonna be helpful for you. Let me change the device again. Yeah. So can you listen to me?
Yes, we listen to you.
Yes, now it's better. I corrected it. So as you could see, that was a presentation with lots of studies, invasive and non-invasive ones. That's the way I prepared it and following the book we have, because if we take pathological images, we never finish. It's a lot of information. And well, time for us to fill the pool. Can you watch the pool?
Yes.
Okay. Okay, thank you so much. Okay, any question you have at this moment? Something you would like to share, maybe? Something
I
you would
would like
like
to
to
say
know?
something.
Because I think it's a clear presentation in order to get the normal structures, the normal way of describing a situation in imagine studies or maybe lab studies. And there's not too much information because, as I was telling you, if I get all the information from all the things we must do, we don't finish anyway. It's a lot of things, a lot of topics that I could add, but that's not the objective, not to get more information that is necessary. So tomorrow we have the workshop. Certainly I've been expecting from your homework. Not everybody sent me them, but there's no problem. We can work with this. And wait, that's all I think. So see you tomorrow, people. If you have any question, you can write me down. I'm going to send you this presentation in a few minutes, please.
Miss, I think Ariana wants to talk.
And let's study for tomorrow, please. We are going to work on your cases, the cases that all of you have.
Miss.
Each one has some specific situation.
Hello.
That's different from your partner, from your classmate. And I hope we can work with this tomorrow. And tomorrow, of course, we are going to see some pathologies different from the cases you are watching. Okay, we were working on. Okay.
Okay, thank you.
Okay. Ariana, you raised your hand.
Yes, I would like to say something.
Tell me, dear.
Okay, I won't be able to attend tomorrow's class because of my schedule at the university. So I was thinking about the possibility if I could be the last on
the organization. Okay, that's okay for me. There's no problem.
Okay, thank you.
Okay, I'm gonna correct the schedule, the order we have, and I'm going to share it with the group. Okay.
Yes, and
Thank you
in
so
my
much.
case, it's different. I don't know if I can be the first one because my job and sometimes I have some problems and I don't know who is the first person. I don't know if we can change place.
Okay, Fabiola, you're the first one. Would you like to change with Johan in this opportunity?
Tomorrow I have class. Maybe if I could be the second one.
Yes, it's perfect. So what would happen if let me correct the schedule, and by WhatsApp you tell me if that's okay. Okay.
Thank you.
So Johan the first, Fabiola the second, and then we are going to continue with the rest, and Ariana the last one. Anyone who would like to change the order, maybe? That's okay for me, there's no problem. We're going to start at 8. Okay, everything's okay, I think, right? Something. Yes. Tell me, Johan.
Nothing, thank you.
Okay, don't worry. Okay, if everything's okay, we can go home at this moment. So let's go for studying, for practicing, and tomorrow we're going to work on your cases. It's a very easy activity. We're going to make a practice one, a practical situation to solve. And if you didn't send it to me because there was no time or something happened, I don't know, tomorrow just for the workshop, come with the case done, okay?
Okay, thank you. See you tomorrow.
Okay, see you tomorrow, everybody. Bye.
Bye.
Bye, see you tomorrow.
Goodbye. See you tomorrow.
Bye-bye. So having some trouble at this moment, we are finishing the class. And well, I hope everything's okay. I used an extra device for correcting the situation. And well, I hope the recording is okay. Of course, with the YouTube live stream session too. So we're going to check it now. Well, I think that everything is correct. The live stream is without trouble at this moment, so I'm going to finish this session. So see you tomorrow and have a nice night. Bye-bye.